Every year, Medicare beneficiaries should review their prescriptions on Medicare.gov or another prescription quoting tool each year. Each fall, these insurance companies, they'll adjust their drug plan premiums, copays, and their formularies, which means that a plan that fits your needs perfectly last year could now cost hundreds more or could even drop your coverage for certain medications that could no longer be on their formulary. So just taking a few minutes to compare your plans, to protect your health, your wallet, of course, because skipping the review each year could mean overpaying and losing access to the prescriptions that you need most. So I'm just going to show you actually how you can update your prescriptions and look at plans for the upcoming years on Medicare.gov. Okay, so I'm going to jump back to the beginning here. Okay, so let's say I want to find a drug plan, right? I want to go to find health and drug plans right here. Find plans now. I'm going to put a coverage year in, a zip code, pick my county. You can always switch this plan type once you're in the actual quoting experience, the consumer facing UI, but I'm just going to put plan B. Okay, and this is if you do have extra help. So extra help is like low income subsidy. So sometimes that can also reduce your copays and your plan premiums as well. So if you know that you have this, it's a good idea to check this off. Now, again, if you are on Medicare, you can actually log in, and I'd recommend creating an account on Medicare.gov too, because it'll store your prescription data. You don't have to type everything in each time you go in to view some of these drug plans or alternative coverage plans. So I'm going to hit continue. Now I have a few drugs in here, just some examples. I'm going to take this out just because it's a complicated one. I'll just add some other ones like, let's see, Diavan. You'll get this option about keeping brand, adding a generic. I'm going to just hit add generic, add to my drug list. And then maybe I'll add a brand here. Let's see. So, okay. This is available in generic form as well, but let me just put overall. Okay. So there's some diabetic medications. I'm going to just click done adding drugs. Now you can pick a couple different pharmacies. So like if I put in, for example, I selected a couple here already. I have CVS, I have Walgreens. I put in my zip code. I put in the pharmacy name, find pharmacies. I can select one and then add this down here if I want to compare the cost of different ones. I hit continue to view plans. So now I have my drug plan options in my zip code. I'm viewing 2026. So there's filters here, but you want to sort the plans by lowest drug and premium costs because number one, that's going to add your annual drug costs to the annual plan cost and kind of give you the lowest option overall, lowest cost option factoring those in overall. So I'm going to hit add to compare. I got Humana, I got SilverScript, and I'll pick HealthSpring. Right, so here I can go to my compare tool. I'll hit compare. You can see the total monthly premium for each of these, the drug deductible, which is usually applying to higher tier medications, oftentimes tiers 3 to 5. This is the standard Part D drug deductible of $615. Again, sometimes the insurance companies can lower that deductible if they choose. This is also the highest it can be for 2026 as part of the standard model. You can see here which drugs are covered, your total drug and premium cost for the year, and it'll give you this breakdown for different pharmacies as well. Okay, so now if I want to see a breakdown, right, of what each plans are covered, let's go to. I can click plan details and I can click view drug coverage. Okay. And I should be able to see my monthly total breakdown here. So you can kind of compare that across plans. You can switch between the pharmacies. You can break it down by what tier are the drugs in as well. Pharmacy and drug costs. You can do a preferred pharmacy. You can change the mail order. Okay. But this kind of gives you an overview when you're comparing plans, right, of your total cost per month. as well. You'll be able to find the actual cost per drug. This is a yearly summary, excuse me, per medication, right? So that kind of gives you the annual cost, and then obviously you can break that down monthly and quarterly. This Medicare prescription payment plan, this is something that all the drug plans have, whether you're doing a Part D plan or an MAPD plan. You can call the plan and ask them, okay, if I have a deductible, right? So if I'm going to meet my deductible in June, basically, obviously that means I'm going to be paying more, usually at the beginning of the year, right? So if I'm paying more at the beginning of the year, I can say to the plan, hey, I'd rather just pay you guys a set amount every month over the course of the year instead of having to have these fluctuating costs, like costs that are higher until I hit my deductible and then they level out. So that is a choice that you can make. You'd be basically making a payment to the plan each month and not paying anything at the pharmacy. Okay. If I click that, that's kind of what this does without this payment option, with this payment option. So you can see the difference there. I mean, you're paying the same thing at the end of the day, but this just kind of spreads it out over the course of the year. Okay, so I'm going to, you can change your drugs. Let's see if there's, this will kind of give you an idea of like what is extra help. I know we touched on that briefly at the beginning. That's always based on income, right? Okay, I want to go back to my plan comparison here, and you can obviously sort by plan details on each plan, but this is the big thing, right? This overall annual cost right here. You can view view the drug coverage by prescription. You can see the cost difference at each pharmacy as well. This again is giving you the annual cost and then the estimated total monthly cost breakdown at each pharmacy. So for more videos on Medicare, you can continue to follow the channel. We have another one right here for you as well. Thanks for joining us.